Okay. So, back in 2009, there was a young boy named Brandon who was born with half of his heart missing. This is a potentially fatal condition known as hypoplastic left heart syndrome. So basically the first days of this young child's life were filled with fear and uncertainty, and his parents had no idea if he would survive if he would be able to live his entire life ahead of him just because of the single unlucky heart condition. Just imagine 10 or 15 years in the future, and you just had your first kid, and you just found out that he's been diagnosed with a condition that would only give him a few months to live. You'd basically do everything you could to try to save his or her life. And so you'd try to go out and you'd find the best surgeon possible to save your kid's life. And in Brandon's case, he was lucky because the surgeons were able to reroute the blood flow in his heart and restructure his heart again. So he's now living a happy and healthy childhood with his parents in Wisconsin. And basically, doctors, nurses, and surgeons are performing miracles every day. They're able to give a gift that no one else can, the gift of life. And that is why I want to go into this field, because I really want to make a difference and save people's lives. And so my name is Pranav, and I'm 16 years old, and I'm a junior at FHS. This is my first year in ISM, and I'm studying cardiothoracic surgery. These are some activities I'm involved in at school. I'm in tennis, HOSA, and VPA. I wanted to take ISM this year because it really gives me the opportunity to get experience-based learning as opposed to just learning in a classroom. And to me, that's invaluable, and you can't get that experience anywhere else and in any other class. So my quote that I chose for the year is, "Live as if you're to die tomorrow and learn as if you were to live forever," by Mahatma Gandhi. And so basically, to me, the first part of that quote really gives you a sense of priority as to what would happen, like what would you do and what would you not do if you were to die tomorrow, and it really makes you think about what matters and what doesn't matter. And the learn as if you're to live forever part, that's really applicable to the field of medicine, because things are constantly changing and you have to always remain updated on all the new information. That's like all the new drugs, all the new procedures, all the new equipment, things like that. And so I think that's a really great quote. So the next part is my research assessments. I just sort of condensed my research assessments. So my first one I did was rapid granulation tissue regeneration from ATP delivery. And basically that was like a new treatment that was being developed. And basically what it did was they were using ATP lipid capsules, and they were applying it to ischemic wounds. And the state of ischemia is basically where there's no blood supply to a certain part of the body. And this is really applicable to like for organ transplants. Like when donor organs won't necessarily have a blood supply, so they will degenerate very quickly, and so this treatment could be used on those to give it a longer viability, so that the surgeons have more time to implant the new organs into the recipient. And so my next article was robotic assisted surgery. Basically what this was, it was about a new device that was created, and it's called the Da Vinci. And basically it's really cool. It mimics the natural movements of the hands and the fingers in order to allow the surgeon to operate in a more natural way. And it's been proven to have the patients had less pain, less discomfort, and the surgery had a much higher success rate with this new system. So I thought I wanted an article like this so I could see like the evolution of like medical technology in the surgical field. And so my next one was antibiotic resistance. Basically, this has been a really common theme. It's been seen a lot. Bacteria has become more resistant to antibiotics because of the overprescription of them. Doctors they're overprescribing antibiotics for patients who undergo things like cancer operations, hip replacements, pacemaker implantations, etc. And so the overprescription of these things is causing the bacteria to build up a resistance towards them. It's rendering the antibiotics, they're less effective on the bacteria, and that's a serious issue. And so I think doctors really need to focus on whether they're if they can prescribe it, or whether they shouldn't prescribe it, and that could solve that. And so my next research assessment I did was on the UNT trip. I thought it was really awesome. I got to go and experience the college environment, I really got a feel for what it was like, and I went to a intro to biology lecture, a bio major lecture, and a biomedical engineering lecture. I thought that was really cool. So my final research assessment was about a rare liver surgery performed in a state-run hospital, and basically what the surgery was performed on a man who had BCS, which is Budd-Chiari syndrome, and basically this is a really rare condition where an occlusion builds up in major liver arteries, and so basically the operation is where they remove the liver, remove the occlusion and reimplant the liver. So it's a really risky operation, and so these surgeons there was a very high risk to this, and they still went ahead and did it, and it was a success. So I thought that was really interesting. And so this is what I've learned. Like, I've learned more about the dynamic between a surgeon and a patient. Like it really depends on if the patient is referred to the surgeon or if the surgeon diagnoses the patient. I think that really changes the way the dynamic between them, because if they're diagnosing the patient, that they were with the patient from the beginning, and if they didn't diagnose them, they just had them referred. And I learned more about that process. And I also learned about what it takes to be a surgeon, like the specific occasions about like your residency, then your fellowship, then specializing even further into like for example, like in cardiothoracics, you have to first go through medical school, then you got to complete a residency, and then you further specialize through a fellowship in cardiothoracics. And then you first specialize in thoracic surgery, then you go and specialize to work on the heart specifically. And so now I know about I mean, this was kind of obvious, but you have to obviously pick a good undergrad program in order to help, in order to increase your chances of getting into medical school. And after talking during my informational interviews, I came to the conclusion that UT Southwestern Medical School is a great medical school, and I'd really like to go there. Some of the things I'd really need to learn are, I want to learn more about the specific kinds of medicine that surgeons use during the surgeries. I'm not really sure about, because like if the body reacts in a certain way, then they might need to use a specific drug on the body, and I want to learn more about that. And I also want to learn more about surgery equipment that's specific to cardiac surgery. I think that would be interesting. So my interviews, my first one was with Dr. Robert Minquez, who's a pediatric general surgeon at Children's, and he was also a former ISM mentor, and he gave me a lot of great advice on remaining constantly updated, always be reading, try to learn as much as you can. My second interview was with Dr. Joseph Forbes. He's a pediatric cardiothoracic surgeon at Children's Dallas. And so he's actually my mentor, and he basically gave me advice about undergrad, and like you don't have to major in a science for medical school unless you really want to. And he told me about the different operations he does on newborns and things like that. I thought that was a really great interview. And so my third interview was with Dr. Sean Haslam, and he's an orthopedic surgeon at Centennial. He told me about like how you should try to get a residency in a big city so that you see more cases and you get more experience. He told me about like surgical complications in orthopedics, and he told me about like arthroplasties and how the patients could end up with a longer leg from the insertion of a prosthesis and things like that. I thought that was a really interesting interview. I also interviewed Dr. Michael McBride, who's a cardiothoracic surgeon at Medical City. And so he was really awesome. He let me actually shadow him after. I got to go on like a round with him after the interview. I thought that was really interesting. I got to go see some of his patients that he operated on, and that was a really great experience. So my original work, basically my thought process, my original idea, what I was going to do is across the board, all the surgeons I'd interviewed, they told me that bleeding was a really common problem that occurs during surgeries, and so basically I was going to test the different methods that are used to stop bleeding. This isn't actually what I ended up doing, but this is what I was originally going to do. And so basically, like once I started doing more research, I realized that this wouldn't be, I wouldn't be able to really do this experiment justice because I didn't have the proper equipment, like a cauterization device, and like that was the setup I was going to do. I was going to have like blood run through something in order to sort of emulate bleeding in an actual patient, and I was going to do something like that, but it didn't really work out. So my new idea was still about surgical complications, but I wanted to I really wanted to think about complications as a whole as opposed to just excessive bleeding. And so what I did was I created a paper which basically ran through all the different negative consequences that could come from cardiac surgery, because I feel that surgery shouldn't have any negative consequences for a patient. I think it should only be good things for them, because that's the reason why they're getting in the first place. They're having it to correct something. They're not having it to add more problems to what they already have. And so I also made a visual aid to go with the paper. And I basically went in and I described each procedure, what it does to the body, and like the proposed, like the current treatment for those extra complications that can arise in a patient. And so like it's basically like an informational tool for patients who are considering to undergo cardiac surgery, or they've like or they're already about to go through it with it. So my next one, from what I learned from my original work, I really learned about the process of creating something in the field, creating something original in the field of medicine, because the field of medicine it's so complicated, and there's so many things that you have to take into consideration when you're thinking about it. And finding something new and that can be actually used by real patients was also really tricky, because I mean, like, there are doctors out there, and they're going to have so much more knowledge about the field, and they can see all the different things about it, and it'll be easier for them to come up with something new and original. So I learned the thought process that went behind it, and I also learned a lot more about. I went really in depth onto the negative impacts that cardiac surgery could have on your body. And so I thought that was really interesting to learn about what could happen from the different types of procedures that there are. And so for my mentor experiences, I ended up selecting Dr. Joseph Forbes, and he's the pediatric cardiothoracic surgeon at Children's Dallas. And he attended Harvard for his undergrad and his medical school, and then he went to Duke University for his residency. So I really felt that I had an instant connection with him. He's a really nice guy, and I could tell that he wanted to be a mentor. I just didn't think I'd get him because of like the logistical side of it, because he's so busy all the time, and he's really high up. And so, but he offered, like when I was talking to him, he said if you ever need to come by and need to shadow me, then I'd be more than willing to do that. I thought that was really nice of him to say that. And I also found a short video clip that Children's had posted of him. I thought it was pretty cool. And so it has to be played through YouTube. So like.
So what do I do?
Like, watch this video. Yeah.
Well, actually, sometimes it's difficult during cases, but he wants the best for his child.
He is a brilliant surgeon, and he's also a really funny guy.
Believe it or not, I knew Dr. Forbes before I came to Dallas. He really has an incredible mind.
Couldn't even get an interview.
Phenomenal surgeon, and I try to learn as much as I can from him. He's also like the big brother I never had, and I want to sometimes just wring his neck once in a while. But he's a great guy.
It's actually an interesting fact that he's actually a musician.
There are rumors. There are rumors.
You may not know this about him, but he actually played in a band at Harvard, in which he was doing
Joey Thunder in the electrical school.
Oh, he'll know exactly what you're talking about when you call him Joey Thunder.
You know, there was a lot of great things that happened in the big 80s, but our band was not one of them.
I thought that was kind of funny. And so yeah, that's him. And so I thought he was a really cool guy. And so in conclusion, ISM has been such an amazing experience so far. And and then basically, like, I mean, I've learned so much in such a short period of time, and that just goes to show how much experience, how much you can learn from experience-based learning as opposed to just reading it in a book. And I think, like, just going on like my informational interviews and all that, it's really given me a glimpse into the future, and like I can see like the path that I'm going to go down, and if to becoming a doctor. And I think it's just been an amazing experience so far, and I hope to continue the ISM journey next year. So, and then this is my weekly blog. And then any questions or anything? Oh my gosh.